Pets are an important part of many homes and at times may require more than an annual visit to the veterinarian.
She was the leftover in the litter, and I felt bad. She was 12 weeks old and very cute.
My wife really wanted a dachshund. She had a friend who had a dachshund when she was growing up. She really liked him, so we decided to get Hannah.
He's the one who's really connected to her mostly. She's very active. She loves to run around, and she never sits still.
Hannah loves to swim. She will just go until she's exhausted. She loves to snuggle, and she loves to burrow under covers. Dachshunds just have such incredible personalities, and they're just so vibrant. One day, she kind of winced when she jumped off the bed, and Wednesday of that week, we started to notice that she was very lethargic.
The doctor did an MRI on her and saw that there were some issues with her spine. And he told me that day that if something happens to her, that she becomes paralyzed or isn't moving as much, that I should take her to an animal hospital immediately.
And Saturday morning when we woke up, she was pretty much paralyzed.
And so we realized at that point we had to get her to the hospital right away. We were very overwhelmed upon arriving at Valley Central. We were scared that this would be it. She was 4 years old at the time, and we just didn't want to lose her.
They confirmed that she had a bulged disc in her back or a ruptured disc of some type, and that it would require surgery to repair it.
When you do these kinds of surgeries, time is of the essence. So the earlier you get to it, the more likely that you're going to be successful.
It was very important that whatever decision we made gets made quickly, and there was just no way that we weren't going to take care of her.
We did a procedure called a hemilaminectomy, which opens up, it decompresses the spinal cord so that the spinal cord now has some room to breathe, and we removed the disc material out of there.
Dr. DiNardo was absolutely incredible. He called us immediately after surgery and advised us that everything went as well or better than it could have. I think it was about after 2 weeks that we saw the first hint, which was actually just a little tail wag, but I gotta tell you, it was the happiest tail wag we ever saw.
And when that tail started to wiggle, we knew it's coming back, her nerves are coming back. So she is back to being the dog that she really was and meant to be.
Joining me in the studio is Dr. Carlos Hodges of the Valley Central Veterinary Referral and Emergency Center. Welcome, Dr. Hodges.
Pleasure to be here.
Dr. Hodges, I've, as you know, been a long-time customer of Valley Central. Tell everybody that may not be familiar with Valley Central the great services that you offer.
Well, first of all, we have a 24/7 emergency center. So we're there for after hours and weekend emergencies whenever something may, come up. And then during the day, we have specialists there. So oncology, cardiology, ophthalmology, surgery, internal medicine, acupuncture. So we are actually an extension of their regular veterinarian. So we are there when they need us in those trying times.
Dr. Hodges, when it is determined that a pet needs surgery, what are the next steps that you take in talking with the family?
Mm-hmm. My main goal is that when that client leaves that exam room, that they understand everything that their pet is about to go through, and they understand the mechanics of it and what they are looking at postoperatively. So first of all, I diagram the procedure. We talk about that in detail. The second thing I do is we sit down and talk about the postoperative course. What are they going to have to do? Restricted activity, leash walks, massage therapy. So I go through a number of things so when they leave, they feel comfortable about what they're going to need to do, what the pet's going to go through, and what the postoperative course is.
And one thing I always loved about you and your brother, you spend a lot of time with the people, with the clients, and explaining everything in detail. Never rushed them. You go over and ask questions. They can ask questions, and it's a full process.
I think that's important. Think about yourself. If you go into your doctor's office for a procedure, you want to be very well informed about what you're going into and what you're coming out with.
And a lot of times after surgery, at possibly their regular vet. People must realize by 8, 9 o'clock their vet closes, and the pet will be unattended during the late evening and early morning hours. And a lot of times they're given the choice, to have their pet overnight.
So we get a lot of transfers from the regular veterinarians out there. So they may, as you mentioned earlier, they may perform a foreign body surgery where they had to go into the stomach and take out an object. So what they will do, since they close at 8 o'clock, they will refer that patient over to Valley Central for overnight monitoring. Then it's transferred back to that practice the following morning.
Dr. Hodges, if a pet has been referred to you for surgery from another vet, how do you go about working with that vet?
Oh, that's a great question. Standard of care is when that patient is first admitted, that veterinarian will receive a fax just alerting them that, Fluffy Brown has been admitted to the surgical department with this problem and this is going to be done. Once the procedure is completed, then that veterinarian will receive a phone call from myself, and then also will receive a summary letter about that case and its disposition. So we want to make sure that they are fully contacted and informed about what happened to that pet.
Dr. Hodges, sounds like you're a great support system for the veterinary clinics out there.
We are, Mike, and we love what we do. And once again, I want to just emphasize, we are an extension of the client's regular veterinarian. So we are there to handle any type of emergent type situation that may present itself. So we have, like I mentioned earlier, we have some of the advanced diagnostics, therapeutics. So we are there, and basically I work with my brother. So we are family. We treat that pet like a family member as well.
Dr. Hodges, thank you so much.
Pleasure to be here. Thanks for having me.
For more information on Valley Central, go to our website, thepeaktv.com. And coming up next, we're going to follow some St. Luke's doctors in the exciting world of cyclocross. Stay tuned. This is The Peak.
The Peak TV is a production of ASR Media.